Other syndrome that we have, you might find a patient with cancer coming to the ER with tumor lysis syndrome. Actually, this is very common when the patient is having cancer that is responding to chemotherapy very rapidly. So usually cancer cells that are being rapidly divided, those are the best responding to chemotherapy. There is a disadvantage, a drawback to this, that rapidly destroyed cells are going to secrete chemicals that will cause tumor lysis syndrome. So tumor lysis syndrome occurs when there is rapid cell breakdown after chemotherapy, most commonly for leukemias and higher grade lymphomas with large tumor burdens that respond quickly to chemotherapy, as I told you. So metabolic changes are essentially caused by cell breakdown or product potassium, which is mainly intracellular, spills into the blood, which can cause cardiac arrhythmia and muscle weakness. So the first thing we found in those patients is hyperkalemia, not hypercalcemia. Pay attention. In tumor lysis syndrome, you have hyperkalemia. So kalemia is another name to potassium. So you find hyperkalemia because those cells are being broken down and the intracellular potassium are being released to the bloodstream. Then you have this hyperkalemia. So this will cause, I have so many potassium outside, this will cause cardiac arrhythmia, and I think you can notice this in the ECG. So I think there is specific wave in the ECG that told you, okay, there is a this might be caused by hyperkalemia, but more usefully go and do the blood test to assess the potassium level. So we have hyperkalemia will cause muscle weakness and cardiac arrhythmia. So this is how can you assess it clinically. Likewise, there is phosphate outside. So phosphate will be released, which can result in renal failure due to the deposition of calcium phosphate crystals, and the calcium levels will decrease. So phosphate will be produced by those lysed cells. Phosphate do not like to sit alone in the blood. So he said, okay, I need a friend. He goes to calcium. Would you be my friend? Calcium says, oh yeah, okay, I feel alone too. So they combine together and make a deposition that will hurt our kidney. Also, since now calcium has a friend, he's not alone anymore. So the calcium level will be dropping, while the phosphate will be high, and there is deposition in the kidney. So massive cell death and nuclear product liberate nucleic acid, and adenine and guanine are broken down to uric acid, which precipitate as ureate crystals and causes ureate renal failure. So unfortunately, the kidney now is being affected by many ways, by the phosphate and calcium crystal and by ureate crystals. What is uric acid? Uric acid is the end product of nucleic acid metabolism. Okay, so I have this nucleus that are being distracted. They are apparently tumor cell nucleus. They are being distracted. This genetic material, DNA, to be getting out. DNA is compromised of what? Of a nucleic acid. Nucleic acid, when you break them down, the end product will be uric acid. Uric acid can make deposition in our kidney, leading to renal failure. Okay. Also, they said, so you will have what? High uric acid level. Come on. So lactic acidosis can occur. So why would I have high lactic acid? Because when cell is being destroyed, this cell try to survive, okay? The cell used to make glycolysis, used to use mitochondria in order to produce its energy, but now, because of hypoxia, because of this distracted mitochondria, it's not being able to carry out glycolysis in the appropriate way. So the end product will be lactate. So the pyruvate will go and turn into lactate, and lactate will accumulate. Okay, so I will have high lactic acid, high uric acid, high calcium, potassium. I have high potassium, low calcium, and I have high phosphate. And phosphate and calcium are deposition are in the kidney. Also, uric acid are making this deposition in the kidney. So to try to prevent a tumor lysis syndrome, so they said that prevention is better than treatment, right? So we need to prevent it. We know this patient on chemotherapy, we know he's responding, so why I don't prevent this from happening? So you have to be smart doctor. So to try to prevent a tumor lysis syndrome, patients should be hydrated. You should hydrate them very well, so we reduce the incidence of mineral deposition, for example, okay? And to enhance the urine output, because more hydration means more minerals and water getting out of your kidneys to urea, okay? Not urea, to urine, sorry, okay? So when you give them hydration, you will facilitate getting rid of those minerals that are being produced by the tumor lysis, okay? So also, not only this, but give them allopurinol. So what is allopurinol? Allopurinol, it reduces the uric acid levels by like stopping the enzyme that make uric acid. So allopurinol and oxypurinol both inhibit xanthine oxidase, an enzyme in the purine catabolism pathway that converts hypo. Okay, so whatever. Uric acid was produced by certain enzyme. This allopurinol will go and inhibit this enzyme. So if it inhibits it, I don't have this uric acid, okay? So once the tumor lysis is established, patient may require dialysis. So, okay, now I couldn't prevent it. It is already here. What should I do? Do dialysis. Help patient's kidney, please, because there's a lot of deposition of calcium, phosphate, and uric acid. So